Welcome into Great Day Washington. This segment is sponsored by WellMedica. A person's sexuality can be considered part of their overall health and wellness because it really does affect a lot in your life.
And while there are products on the market for men's health, what about women's? So here to clarify the options for women is Dr. Dima. So good to have you back, Dr. Dima.
Thank you.
Okay, this hormone replacement therapy has been around a long time, but it's still controversial. Why is that?
Yeah, it's actually very controversial, and unfortunately, in the last 20 years, over 20 years, it has not come as far as I expected it to. And probably first of all, bioidentical hormones in general have been around since ancient times. Well, fast forward to the 1930s and 40s, we were using extracts from testicles and ovaries and injecting them in both men and women to relieve symptoms. And then fast forward again to the late 1990s and early 2000s, the NIH Women's Health Initiative study caused a great scare among people that I thought by this time would have dissipated a little bit, but it still seems to be there. People equate the use of hormones with cancer.
Okay, so then what's the difference between bioidentical hormones and traditional hormones?
So the traditional mare-derived or laboratory-created hormones are not bioidentical, meaning they don't have a lock and key mechanism. So that lock and key mechanism between a substrate and an enzyme does not work. And when they try to bind each other to do a chemical reaction, they bounce off pretty much or create metabolites. And those consequences of those metabolites are what cause things like cancer and bad side effects. So with bioidentical plant-derived soy, yam, chemicals come from the soy and the yams, but it's still bioidentical because it fits the human molecular structure exactly. And when it fits, there are not the side effects of, the worry of cancer, et cetera.
When it comes to with menopause, the bioidentical hormones, does it help with that?
Oh, absolutely. Honestly, hormones, I think, in general will help. I think all women that are suffering in their 30s, even 40s, 50s, and beyond should be on some form of hormone because it's available. And it's not just about that, it's about your overall health. Hormones play a part in every organ system. Your skin, your cardiac health, your gastrointestinal health, every body organ. Helps you sleep better. It does a whole slew of things that increase our longevity and give us a better quality of life.
What do you recommend maybe is the best way to get those hormones then?
So there are creams and multiple things we can use. There's gels, patches, and then there is a pellet. A pellet is a very concentrated form of testosterone. It's about the size of a Tic Tac, as you can see. They are implanted into the upper hip in a minor surgical procedure done under local anesthetic. And it's time release. Women get it approximately every 3 to 4 months and men every 4 to 5 months.
What makes a good candidate for bioidentical hormone replacement?
Anybody who wants a better quality of life. Anybody who, I have women that are on 3 different antidepressants or on multiple cholesterol medications, and in fact what's going on is an imbalance of their hormones. Once you balance the hormones, you can wean people off of things like antidepressants and cardiac medications. Not entirely, but for the most part.
You see the benefit.
You see the benefit.
Yeah. Okay, so there's technologies to also help women with, is it urogenital issues?
Urogenital.
Thank you.
Right. So
Yeah,
lack of hormones also causes dryness in the vagina, thinning of the lining of the vagina, which leads to painful sex, frankly, and incontinence, because it also affects the bladder. So we have technologies now that are completely non-invasive, that don't require anesthesia, that can actually cure these symptoms. But if you want restoration of function, and you want your life back, and you don't want your husband to leave, you need to get something that is either laser-based or radiofrequency-based, which is my preference. I think is the gold standard for tightening the vagina.
Okay.
And that's a
that's the-
probe, right? How does that work?
There is a probe that we use. There are multiple probes. So
Right.
depending on the technology, there are multiple probes that we use that are made to fit in the vagina. And typically we do 3 treatments. They're about a month apart. We have other technologies that will help incontinence, that go a little bit deeper towards the muscle and can increase your pelvic floor strength that we lose as we give birth. Even 10 years ago, barely 10 years ago, we did not have non-invasive treatments.
Wow.
Wow.
So there's hope
So
for
much I just
know.
learned here.
I know.
There's so much in there. Thank you so much
My
for all
pleasure.
of the information. Yes.
Thank you for having me.
And for more information about Dr. Dima's services, you can call WellMedica at 703-787-9866.